In terms of distribution and arrival of all the supplies, and then ultimately, once we do officially get this authorization from the FDA, the vaccine itself, what are you seeing on the ground at your hospitals in Kentucky?
Well, we're quite busy, actually, following the Thanksgiving holidays, the surge in patients. We're seeing that across the state and southern Indiana. So lots of activity as far as COVID patients, but we're very prepared to distribute the vaccines as soon as they do become available to us here on the ground, not only in Kentucky, but in southern Indiana.
The actual process of securing supplies, now, correct me if I'm wrong, but it seems like frontline workers within some of your hospitals will get this vaccine first. But given the fact that while we're expecting so many more millions of doses in the coming months and into next year, securing the actual supply you need right now, what has that process looked like, and what do those conversations continue to look like as future supplies are negotiated?
So we've been in constant contact with state and federal officials with regard to the distribution of the vaccines. And we had to prepare our supply chain and our hospitals in order to be able to receive, because as you're aware, they have to be in an ultra cold freezer storage. And the chain of cold storage is extremely important. So we've been very diligent working with those officials, as I've mentioned, about how we acquire the vaccines, and then ultimately the distribution plan that will be in phases. And you're right, we'll be vaccinating our frontline healthcare workers first. And in addition to that, we do have a vaccine plan in the state for our nursing homes as well.
So, Gerard, what are your expectations for how quickly your frontline workers, your workers in your hospitals will actually have a vaccine?
Well, I'm very excited and optimistic that we'll be able to vaccinate very soon. As you're aware, the advisory panel gave authorization yesterday late afternoon. We're waiting for the FDA to issue their emergency use authorization. And once we receive that, those distributions of vaccines will start immediately, and then we'll be vaccinating as soon as we get the vaccine. Going back to the cold storage, once the vaccine is thawed, it's only viable for 5 days. So the distribution has to be very thoughtful, as well as the vaccine plan. It also requires 2 doses. So we have to make sure that everybody that's vaccinated is in line to have a second dose as appropriate.
Yeah, we've heard from some of the logistics companies this week. UPS is a good example. They're going to be making tens of thousands of units of their own dry ice. Their tractor trailers are going to be escorted by security. When you think about risks to the supply chain beyond just the actual manufacturing and ordinary distribution, what do you worry about the most?
Really, it's a matter of getting it to the hospitals as quickly and as efficiently as possible. We're very confident in the vaccine itself. The efficacy of the vaccine is quite high, as you know. So we're looking forward to getting that and distributing it. We don't see any supply chain challenges once we receive, or even prior to when they get delivery to the state, with any challenges there. We're just excited and optimistic to be able to vaccinate those frontline healthcare workers as quickly as we can.
Shepard Smith here. Thanks for watching CNBC on YouTube.